Are you experiencing gas, bloating, abdominal pain, diarrhea, constipation, anxiety, belching, acne? If so, you may be suffering with irritable bowel syndrome, or IBS. That is approximately 20% of the global population. They've been diagnosed with IBS. How do you go about resolving these unwanted symptoms? Let's dive in. Hello, my name is Dr. Nallely Ibarra. I am a licensed naturopathic physician at Natural MedDoc. Today, I'm going to share with you how SIBO, or small intestinal bacterial overgrowth, could be the cause of your unwanted health symptoms. In this video, you will learn how the digestive system works, what is SIBO, what causes SIBO, what steps can you take to resolve it. So, how does the digestive system work? Digestion actually begins in the mouth as we are chewing our food. Food passes through our esophagus to our stomach, then it reaches our small intestine, where the majority of the absorption happens. Then it goes into the large intestine to be eliminated in our stool. You may have heard that in our intestines we have healthy bacteria that help in digestion. In unfortunate cases of food poisoning, we introduce pathogenic or bad bacteria that can lead to temporary diarrhea, nausea, and vomiting. What you may not know is that only small amounts of healthy gut bacteria should live in our small intestine. Small amounts of healthy gut bacteria is healthy. Larger amounts of bacteria can lead to unwanted symptoms. Hit the like button if you're learning something new. What is small intestinal bacterial overgrowth? As I mentioned above, if you're suffering from the following: frequent gas, bloating, abdominal pain, anxiety, belching, acne, you may have IBS or irritable bowel syndrome. But emerging studies suggest that about 60 to 80% of all IBS is actually due to SIBO. So what is SIBO? SIBO is defined by large amounts of bacteria in the small intestine, which would be approximately greater than 10,000 colony-forming units per milliliter. Remember from before, large amounts of bacteria in the small intestine is not good. Why? These bacteria ferment the food that you're eating and release gases that can damage your small intestine, leading to the most common symptoms of frequent gas and bloating. The abdominal distention is commonly described as looking like a pregnant belly that magically disappears in the mornings. Please share this video if you think this knowledge can help. As a person that has personally experienced SIBO, I can tell you that SIBO symptoms can range from mild to severe. The symptoms can truly impact the quality of your life. I can still remember having to cancel my hike down to the Grand Canyon because it was as if my bowels had a mind of its own and I didn't know when I would be in need of a restroom. Then, as time went on, I began to experience horrible anxiety, which is something I had never experienced before. I felt like I was going crazy. Later on is when the bloating began. My abdomen would be distended and it felt rock hard. Sometimes the pain was so strong that I would have to walk hunched over. I'm sure some of you can relate, right? Not a fun experience. If you have questions, please comment below. So, what causes SIBO and how can you relieve this unwanted health symptoms you may be experiencing? The cause of SIBO is still under research. Possible associated causes and risk factors include food poisoning, ileocecal valve dysfunction, hypothyroidism, diabetes, Ehlers-Danlos syndrome, abdominal surgery, chronic stress, recurrent antibiotic use. And the list goes on. But the common denominator for these causes is impaired or slow gut motility. So, what steps can you take to resolve it? SIBO is a rather tricky bacteria. There are three main treatment options that are available: pharmaceuticals, such as antibiotics; botanicals, such as herbs; nutraceutical, such as taking supplements. But what may work for you may not work for the person next to you. Sometimes taking more than one approach will be necessary. It is imperative to get tested during the SIBO breath test to pinpoint the issues you are having. Treating SIBO when you are not 100% sure it's SIBO can actually be harmful to your body. If you would like to learn more, book a free consultation with one of our health advisors who can help you get feeling amazing again. Just go to naturalmeddoc.com and click Book Free Consultation. In conclusion, digestive problems are some of the most common concerns for why our patients come and see us. They are often at a loss when they are told that their endoscopy, colonoscopy came back normal. They are left with an IBS diagnosis, but nothing to make them feel better. They are frustrated that their gas and bloating, abdominal pain, their alternating diarrhea and constipation are unresolved. But what if SIBO breath test could be pointing us in the right direction towards healing? Digestive issues go beyond your bowels. They can influence your mental health and clarity, your skin, and even your hormone balance. I can't imagine where my health would be if I didn't know about SIBO and my GI concerns went unresolved. I know it can be discouraging, but there is help. If you're thinking, wow, this sounds like me, or maybe someone you know, don't wait. It's time to make a change. Work together with a local naturopathic physician or go into Natural Med Doc for comprehensive health assessment, development of an individualized treatment plan. Go to naturalmeddoc.com to learn more. I hope this video educated you to aid you in living your best life.